right, hello everyone. My name is Mary. I'm one of the physical therapists at Cornerstone Physical Therapy. I work at our Woodfin location in North Asheville. So if you live out near Beaver Lake, that's around where we're at. Today's topic is, why does pelvic pain hurt? So there's a lot of different muscles we could talk about, but we're gonna be specific just to not chase too many rabbit trails. So here's the pelvis from the front view and the back view. There's your last lumbar vertebra there. If we look inside, anything red you see are muscles. So these are muscles that you can't see. People, like if you're a specialist in pelvic PT or if you're a gynecologist, you know how to feel in these muscles and check them out, see if they're tight, strong, weak, that kind of thing, but you can't see them. You can only feel them. These are the muscles that you feel contract when you do what's called a Kegel or a Kegel. So that was the inside view. Again, there's that. And I'll show you the outside view. This is a female model, but the muscles are more or less almost exactly the same. It's just, since this is female, there's the vaginal entrance right there, but pretty much everything else is the same. So we also have some more superficial muscles there too. So outside, kind of more superficial first layer pelvic floor, and then again from the inside, deeper pelvic floor. And we can see, if we take a closer look, that they go around the urethra there, they go around the vaginal canal if you're female there, and then men and women, the rectum there. And some of them, if we flip it a little further, that is the coccyx right there. So just taking that into account, you can think about how one could have a lot of problems, specifically what we're going to talk about today, pain, when those muscles are too tight or dysfunctional. And that is one of the main reasons that someone will have pelvic pain, at least pain referred from the pelvic floor or directly in the pelvic floor, if they're too tight or have what we call trigger points, where there's like that extra one spot on a muscle that feels kind of round or ropey, hard when you press on it. And often the person will tell you, ouch, that kind of hurts when you press on that. So why does pelvic pain hurt, and what might that feel like? So for men and women, when your pelvic floor is too tight, one symptom you can have is that you'll have a burning or stinging type of sensation with urination, almost like you have a UTI, and it can be a little confusing sometimes, because you might even go get tested for UTI and it comes back negative, and you ask yourself, well, why does it burn when I pee? You probably have muscles that are too tight around your urethra in the pelvic floor. So that's one example. Another example for females, you can have insertional pain with intercourse or pelvic exam, tampon use. And again, those kind of forefront muscles that we saw on the model here, like right there around the entryway, they're probably too tight. And therefore it's an uncomfortable stretch to those muscles, and they tend to feel kind of burny or raw, even what you might think is dry, but it might actually, for women who are postmenopausal, you might think, oh, well, I just have dryness. Maybe, and that's something, a conversation you want to have with your gynecologist. If they get you on something and it doesn't help, it may also be that you have tightness in those muscles, and it will feel similar as if you're dry. Some other things that you might experience with pelvic pain, men and women, coccyx or tailbone pain, that little bone right below our sacrum on the back side. Often people will experience tailbone pain when they sit, if the muscles there are too tight, or just they might have had a previous injury where they fell on their tailbone, or fell off their bike, what have you, where there's some type of pretty forceful impact, and they usually remember where that bone is now a little more forwards. And with it just being forwards, you develop those trigger points in those muscles, and that can cause pain just with sitting. Another symptom men and women can have is you're trying to have a bowel movement. And number one, it could be difficult if the muscles are too tight, since they go around the rectum, but also you can actually have pain either during or after. You might feel achy or sharp. You might have spasms during those times. And let me look at my cheat sheet, see what else I wanted to mention to you guys. Those are the main things. And then with men, sometimes they'll get through all these tests because they start to have some kind of like weird, like I have pain at the end of my penis or in one testicle. And you go through all these different tests, urologists, get all these testings done, and everything comes back negative. You're fine, your bladder's fine, you empty your bladder, you don't have STDs or STIs, and you still can't figure out why you have pain, that actually can be what's called referred pain from those internal muscles to that area on your genitals. Now it could be other things too. Sometimes it can come from your rectus abdominis muscles in the middle if you have trigger points, or some leg muscles like the hip adductors. But oftentimes there is at least one location inside the pelvic floor where you have a trigger point, and that's causing some of that pinpoint specific pain in the genitals. So those are just a few quick examples of why pelvic pain hurts, what it might feel like in different areas and different sensations. And I hope you guys have a great day.